Well, up first on the show, let's go across to our newsmaker of the day, Dr. David Nabarro, Special Envoy of the WHO Director General on COVID. Now, Dr. Nabarro, thank you so much for speaking to NDTV. WHO recently accepted that coronavirus is airborne in closed areas and released fresh guidelines. This is after scientists had written to them. Now, do you think this is something that should have emerged earlier? It would have helped us in dealing with the spread of the disease?
Well, on every issue, there are, frankly, debates between groups of scientists. I would not read a huge amount into the fact that a lot of scientists wrote. I'm personally very glad they did, because they were people saying, on the basis of all the work that we've done with theoretical studies, plus what we're seeing from around the world, we think this is important. And the WHO people have been looking at aerosol transmission as an issue for quite a long time and have been also trying to work out how important it is. And what really happens in life when we're trying to deal with something that's new like this is that there are debates, and then you have to have some people somewhere whose job it is to pull all the evidence together and say, well, on balance, it looks as though A is happening or B is happening. And personally, I think that's right. And actually, we're shifting our understanding of this virus, how it's transmitted, how to treat it, how to also get life back going again, despite the fact the virus is around us incredibly fast. 500 scientific papers each day having to be assessed, lots of debates, lots of continuous television with pundits coming on. That's good. That's how it is. Sorry, I was using pundit in the traditional way, a very good term, I think, pundit, the teacher. So I just think, yes, let's keep the debates going. Let's recognize that we're relying on WHO people to do an incredible task of filtering everything and trying to come out with guidance. And yes, let the debate go on. That's how we have to work from now for the foreseeable future.
All right, now there's a WHO team that is in China, and more are going to be going to China to study the origins of the virus. Now, how will this help us in combating the spread of the disease, especially now since it's spreading, and in India we're seeing a rapid spread of the disease?
Well, I want to say that really for combating it, we have to focus on the issue here and now. In India, as I was just listening in the program, you're dealing with the here and now of a virus still proving really hard to dislodge out of some urban areas, going into the smaller towns, into some rural areas. So this is real hard work for everybody now. And my big message is don't get bored, go on, keep focusing on it. This is the job that's going to be with us for many more months, and we've got to do it right, and we've got to do it in a way that really engages people everywhere in it. Now, looking at how this all started is important for two reasons. First of all, because actually we really all want to know how on earth has this extraordinary thing actually come upon us. Secondly, we don't want any more like this to happen again. We've already had Ebola, we've already had bird flu, which was an issue in India as well as in other parts of the world. We've now got this coronavirus. We don't want more of these, so let's learn more about how they start in order that we can put in practice the right precautions for the future.
Now, recently, a UK study has claimed that the disease has caused brain damage in few of the patients. Now, this is very frightening. What do we know about the long-term impacts of coronavirus?
But this is really important. You see, there were many who were saying this is just a mild disease caused by a virus that's no more severe than a mild flu. It's not true. This is a really dangerous virus, and we learn about it more and more all the time. Even in India, you found that it appears that coronavirus is associated with capacity of blood clots to develop, which can have all sorts of other complications besides the chest. And now we've got this new information suggesting that there is a proportion of people, maybe as many as 5%, who develop long-term central nervous system challenges, real tiredness, and perhaps also some loss of memory and other things. So I'm just saying, yes, go on taking this virus seriously. Yes, let's keep getting information about what additional complications people are having, and let's encourage the medical research people to look at what I call the epidemiology, where you study the patterns of disease and you see what the results are. I'm absolutely sure that there are people who've had this disease who are still experiencing quite long-term symptoms. And to all of you who are feeling like this, I would say you are not alone. This is important. Keep a check on your symptoms and make sure that you are talking to your medical practitioner about it, because it seems as though there are some long-term sequelae, including tiredness and indeed some confusion. Let's hear more about it.
Right. And if we talk more about, India and the numbers that we're seeing here, we've seen the numbers going up rapidly. Over 29,000 was the number of cases reported in the last 24 hours. The recovery rate is also very good, but our doubling rate is more than many of the other, in fact, more than the top two countries, which is also very, very concerning.
Well, the doubling rate is a key number. That tells you whether or not your actions are slowing the spread. Linked to that, you need to know whether people who get the disease have got it from those who are known to have it, or whether there is transmission through unknown sources. You also need to know what the percent positivity rate of your tests are. And if that's up in the 8 or 9 or 10%, that's also telling you that things are advancing. Yes, the situation is advancing in India. It is a cause of concern. And I think it's always necessary for government to keep being clear with everybody. There's a series of key strategic principles about interrupting transmission and suppressing outbreaks that everybody must follow. There's some clear rules of thumb for adapting those strategic principles to the situation, whether it's rural or urban, very dense or less dense. Thirdly, it's absolutely necessary to have consistent communication at all times. And we've seen that countries where that's not done have bigger problems. And fourthly, there's a need for everything to be monitored for accountability. Now, all I'm going to ask of every country, and that includes India, is keep the continuous and clear communication about what's happening. Keep making sure that the strategic principles are understood, and stress to everybody, this is for the long haul. We're going to have to keep working on this. And yes, it's going to be tough.
Well, thank you so much, Dr. Nabarro, for speaking with NDTV.